Welcome to Mansik Shakti Foundation, the course of Mind Sciences for Students' Health. We have been discussing about navigating challenges of students' life. And one of the challenge which emerges vividly is that of mental health. In fact, I would place on record that whatever be the problem in life, whether it is financial or of relationship or of academics, the first symptom to appear is psychological. And therefore, it is important to understand mental health. And today, we will discuss about mental health conditions, mental health risk, and mental disorders. It is true that if we see the survey data, the official statistics and research findings, we find that in our country about 15 to 16% people suffer from one or the other mental disorder at any given point of time. And students' population is no different. Even in their population, 13 to 14% students suffer from one or the other problem. In fact, if we consider stress, which is prevalent in more than 50% of students in our universities. If we talk about depression, it is prevalent, it is seen commonly in about 20% students in university and colleges. If that's the case, do we think that it may be affecting their career choices, their career progress, their jobs, employment, productivity, and daily life? All of these get affected because of mental health conditions. So I said one figure that about 15% suffer from a mental disorder. But these disorders are defined by well prescribed criteria. There are many others who do not fulfill the criteria. They are short of that criteria. And therefore they do not enter into that compartment which we can call a psychiatric disorder or a mental disorder. They are at risk, have one or the other symptom, they are suffering, they have disability and difficulties in their life, and they struggle much more. Even they are standing at the door of entering in the compartment of psychiatric disorder. And we cannot ignore that. That about 10 to 12% is this population. Over and above, another 5 to 6% population is the vulnerable population. For example, a child who is suffering from a physical disability like hearing loss, inability to see, inability to hear, inability to walk, or had incidents of chronic physical disorder, for example, head injury or neurological conditions, asthma, so on and so forth. It is well known that those who suffer from chronic medical conditions, about 30 to 40% of them develop a secondary psychological reaction, psychological disorder. All put together brings the number of those who need active in mental health intervention and those who can continue to develop their mental health on their own. We can divide this student population into these two subgroups. One which will require active intervention as well as prevention, and the other who will require only mental health development techniques. So those who are suffering from mental disorders and are at a risk of developing a mental disorder are not less than 30% population. 3 out of 10 are those people who need to pay attention to their own life and find out what's wrong. Now the question is, who is going to tell them what to do, what not to do? As you know, our system, we do not have a system where everybody is seen by a doctor and a doctor advises that you must go this route or that route. Everybody doesn't have a family physician practice where we can access. We go to the doctors for conditions of disease. We do not go to the doctors for conditions of health. Therefore, it is highly unlikely that in a routine medical health screening, someone would find out who are vulnerable. That would have been the ideal situation, to run a screening of entire student population in a given school to find out who is the vulnerable candidate, who is the person suffering from a psychiatric disorder, and who needs support to develop mental health in a positive manner. If that is a possibility, fantastic. But if that's not a possibility, or even if that's a possibility, it is incumbent that mental health education imparted to you is such that you can identify your problems. After all, it's your life. You have to take control of your situation. Must be capable enough, empowered enough to identify what a mental disorder is, how it develops, what should be done, and how to prevent it. What are the treatments available? How effective are the treatment? How much a person improves or he doesn't improve? For example, if somebody knows that he has a learning disability, or his IQ is little less, or he has a dyslexia, that person must know how it is diagnosed, how it is treated, what kind of social support can be given, how much is recovery possible, and how much he can progress, what are the conditions of job, employment, career, what are the special support available to him, and where to get them from, who is going to accompany the person, who is going to look after that student, to arrange all those kind of things which he needs. These are prescribed under special needs for certain children who have this problem. See another example, that somebody who is about 10-year-old and develops hyperactivity, or what we popularly call it ADHD, attention deficit hyperactivity disorder, which is a brain condition, is seen in about 2 to 3% of children in our country. So once this child grows, should he not know what is his problem, how it is diagnosed, what are the limitations, medications are helpful or not helpful, how long to continue, what is the likely outcome, what is he likely to gain, are there people who are achievers, are there people who live normal life, when will ADHD symptoms subside, will it subside, will it not subside, is he vulnerable to develop another psychiatric condition or not, and host of other situations. Certain basic, common, minimum information about mental disorders is extremely important to be given to students in their curriculum, in their school. It should be displayed on the notice board. Watch out for, seek support from this place, meet the resource person of the school, etc. There are a number of methods it's possible to do that. So that brings us to a condition. Let's first define what is a mental disorder. A mental disorder is a condition where mental well-being is affected. So it's a group of disorder. Number of disorders are defined under it. It can be disorder of emotion, it can be disorder of thought, it can be disorder of mood, it can be for disorder of volition or the way we understand things, it can be disorder of will, etc. So all our psychological functions, when they start going abnormal or are controllable, these disorders are likely to. Now it is well known that how a mental disorder develops is not precisely known till date. However, most researchers and experts agree on current understanding that several factors combine uniquely leading to mental illness. There is a general consensus that mental disorders are multifactorial and no single factor is responsible. The brain is the most complex organ in the human body. Mental illness occurs when the brain, just like any other organ such as heart or the kidney, is not working the way it should. Mental illness is a collection of disorder. For example, like depression, bipolar disorder, anxiety. The symptoms can range from loss of motivation and energy, changed sleep pattern, extreme mood swings, disturbance in thought or perception, or overwhelming obsession with fears. Mental disorders interfere with the relationship and affect a person's ability to function on a day-to-day basis, often leading to a social isolation. Many people have mental health concerns from time to time, but a mental health concern becomes a mental illness when the ongoing signs and symptoms cause frequent stress and affect your ability to function. This is very important. Just because you have certain symptoms does not mean that you have a mental disorder. But symptoms are the precursors. Symptoms are identified. If your mood is changing, you feel hopeless or helpless. It doesn't mean that you suffer from depression, but it is a warning sign that you must capture. Mental health problems can have a wide range of causes, and these factors can be biological, psychological, social, environmental, and spiritual as well. We will discuss mental health conditions in detail.